Welcome to today's video, where we'll be discussing diseases of the liver. The liver is an incredibly important organ, responsible for a wide range of functions that are essential for our overall health and well-being. Unfortunately, the liver is also prone to a variety of diseases, some of which can have serious consequences if left untreated. The liver is a vital organ that plays a crucial role in many bodily functions, including metabolism, detoxification, and blood clotting. It is the largest internal organ in the human body, located in the upper right abdomen, just behind the rib cage. This detailed anatomical illustration shows the liver's lobes, blood vessels, and other key structures in a vibrant color scheme, helping us understand its complex anatomy. Understanding the liver's anatomy and functions is essential for identifying and treating various liver diseases, which can have significant impacts on the body. In this presentation, I'll provide an overview of some of the most common liver diseases and their effects, so we can better recognize and address these important health issues. The liver is the largest internal organ in the human body, located in the upper right abdomen. It is responsible for over 500 vital functions, including filtering blood, producing bile, and storing nutrients. The liver performs critical roles in metabolism, detoxification, and protein synthesis. It also plays a key role in regulating blood sugar levels, producing clotting factors, and removing waste products. This 3D model illustrates the anatomy of the liver, showing the blood vessels and gallbladder in vibrant colors. The smooth, sleek medical illustration style helps visualize the complex structure and functions of this vital organ. The liver is a vital organ that performs many essential functions in the body, so liver diseases can have a significant impact on overall health and well-being. This slide provides an overview of some of the most common types of liver diseases, including viral infections and chronic conditions like fatty liver disease. Understanding the diverse causes of liver diseases, from viral infections to lifestyle factors, is crucial for proper diagnosis and treatment. A liver disease symptoms can vary widely, so early detection is key to preventing serious complications and maintaining good liver health. A prompt diagnosis and effective management of liver diseases are essential for preserving optimal liver function and quality of life. Viral hepatitis is a serious liver disease caused by different types of viruses. There are 5 main types: hepatitis A, B, C, D, and E. Hepatitis A and E are spread through contaminated food and water, while hepatitis B, C, and D are spread through contact with infected blood and bodily fluids. Each type of hepatitis has a specific virus that causes it. It's important to understand the different transmission methods for the various types in order to prevent the spread of these diseases. Alcoholic liver disease is a serious condition caused by heavy, long-term alcohol consumption. Excessive alcohol intake is the primary driver of this disease. Alcohol abuse leads to inflammation, fat buildup, and scarring, fibrosis, in the liver. Over time, this chronic damage can progress to cirrhosis, where the liver becomes severely scarred and dysfunctional. Cirrhosis is a very serious condition that can have life-threatening complications if left untreated. It's critical for those with alcoholic liver disease to stop drinking alcohol and seek medical treatment to prevent further liver damage. NEFLD is a common condition that affects a significant portion of the population. The key risk factors include obesity, diabetes, high cholesterol, and insulin resistance. NEFLD can progress through various stages, starting with simple fatty liver, then advancing to non-alcoholic steatohepatitis, NASH, fibrosis, and ultimately cirrhosis. In the early stages, NEFLD often has no noticeable symptoms. Diagnosis typically involves blood tests, imaging, and potentially a liver biopsy. The primary management approach focuses on lifestyle changes, such as weight loss, a healthy diet, and regular exercise. Medications may also be used to address any underlying conditions. Cirrhosis is a serious liver disease caused by long-term damage, often from chronic hepatitis, heavy alcohol use, or fatty liver disease. The main symptoms include fatigue, yellowing of the skin and eyes, jaundice, buildup of fluid in the abdomen, ascites, swelling in the legs, edema, and easy bruising. These symptoms can also indicate other liver problems, so a doctor will need to do a physical exam, blood tests, and imaging scans to diagnose cirrhosis. In some cases, a liver biopsy may be needed to confirm the diagnosis. Treatment focuses on managing the symptoms and preventing complications. This can involve medications, lifestyle changes, and in severe cases, a liver transplant. A liver cancer is a serious and complex disease with several different types. The most common type is hepatocellular carcinoma, HCC, which often develops in people with chronic liver disease. Cholangiocarcinoma is cancer of the bile ducts and can be either intrahepatic, within the liver, or extrahepatic, outside the liver. Hepatoblastoma is a rare type of liver cancer that primarily affects children. Metastatic liver cancer refers to cancer that has spread from other organs, such as the colon, breast, or lung. Understanding the different types of liver cancer and their risk factors is important for early detection and effective treatment. Hemochromatosis is a genetic disorder that causes the body to absorb too much iron, leading to iron overload. This can cause a range of symptoms like fatigue, joint pain, abdominal issues, and changes to skin pigmentation. Diagnosis involves blood tests and genetic testing to confirm the condition. The main treatment is regular bloodletting or phlebotomy to remove the excess iron from the body. If left untreated, the iron overload can cause serious organ damage like cirrhosis, heart problems, and diabetes. It's important to catch and manage hemochromatosis early to prevent these dangerous complications. Wilson's disease is a rare genetic disorder that causes copper to build up in the liver, brain, and other organs. The body cannot properly excrete excess copper, leading to toxic levels in the liver and other tissues. Symptoms can include liver damage, neurological problems, and psychiatric disorders. Treatment involves medications to remove copper from the body and dietary changes to limit copper intake. Early diagnosis and treatment are crucial to manage the condition and prevent long-term complications. Autoimmune liver diseases are a group of conditions where the body's immune system mistakenly attacks healthy liver cells, causing inflammation and damage. The most common types are autoimmune hepatitis and primary biliary cholangitis, which are believed to be caused by a combination of genetic predisposition and environmental factors. Treatment typically involves immunosuppressant medications to help calm the overactive immune system and manage symptoms, while closely monitoring liver function. Careful management is crucial, as these conditions can lead to serious complications if left untreated. A liver failure can occur acutely or chronically, both of which have distinct characteristics and causes. Acute liver failure happens suddenly and rapidly, often due to viral hepatitis, drug overdose, or toxins. It can be life-threatening. Chronic liver failure develops gradually over time, usually as a result of underlying liver diseases like cirrhosis. Symptoms can include jaundice, fatigue, and fluid buildup in the abdomen. It's important to understand the differences between acute and chronic liver failure in order to provide the appropriate treatment and care for patients. Liver transplantation is a complex but life-saving procedure for patients with end-stage liver disease. The process involves a thorough evaluation to assess the patient's suitability, followed by being placed on a waitlist for a donor liver. Once a suitable donor liver is found, the diseased liver is removed and replaced with the healthy donor liver. After the surgery, the patient requires extensive. Liver diseases can be diagnosed through a variety of tests, including blood tests, imaging studies, and liver biopsies. Blood tests assess liver function by measuring levels of enzymes, bilirubin, and proteins. These help detect liver damage and monitor disease progression. Imaging techniques like ultrasound, CT scans, and MRI provide detailed images of the liver to identify structural abnormalities, tumors, or inflammation. A liver biopsy involves taking a small tissue sample from the liver for microscopic examination to determine the cause of liver disease and assess its severity. These diagnostic tests are important for accurately diagnosing and managing liver diseases. Imaging techniques are essential for assessing the health and condition of the liver. Ultrasound, CT scans, and MRI are the most commonly used imaging modalities for the liver. Each technique offers unique advantages and helps doctors diagnose and monitor liver diseases effectively. The liver's complex internal structure, with its blood vessels and surrounding organs, can be clearly visualized through these imaging methods. These techniques allow physicians to detect abnormalities, assess disease progression, and guide treatment decisions for liver conditions. A liver biopsy is a minimally invasive procedure to obtain a small sample of liver tissue for examination. It involves 4 key steps: obtaining informed consent from the patient with a detailed explanation of the procedure and potential risks, administering local anesthesia to numb the skin and underlying tissue, inserting a thin needle into the liver to collect the tissue sample, analyzing the collected tissue sample under a microscope. This procedure plays a vital role in diagnosing liver diseases, assessing disease severity, and guiding treatment decisions. It is performed under local anesthesia to minimize discomfort for the patient. Liver function tests, LFTs, are a panel of blood tests that provide valuable insights into the health and function of the liver. These tests measure different aspects of liver function, including enzymes, proteins, and bilirubin levels. Abnormal LFT results can indicate various liver conditions, such as hepatitis, cirrhosis, and liver cancer. Interpreting LFT results requires considering the patient's medical history and clinical findings. Abnormal LFT results will prompt further investigation and management to determine the underlying cause and appropriate treatment. The table on this slide provides a summary of the key liver function tests, their normal ranges, and what they indicate about liver health. I encourage you to refer to this table as a quick reference when discussing liver function tests and their interpretation. Jaundice is a common symptom of liver disease, where the skin and eyes turn yellow due to a buildup of bilirubin in the body. Fatigue is another common symptom, where patients feel constantly tired and weak, even after getting plenty of rest. Intense itching, especially on the palms and soles, can also be a sign of liver problems. Fluid buildup in the abdomen, causing swelling and discomfort, is another indicator of liver disease. These 4 symptoms, jaundice, fatigue, itching, and abdominal swelling, are some of the most common signs that someone may be experiencing liver issues. A liver disease can lead to a number of serious complications that impact the body in different ways. Ascites is the buildup of fluid in the abdomen, which can cause swelling, discomfort, and make it difficult to breathe. Encephalopathy is brain dysfunction caused by the liver's inability to filter out toxins. This can lead to confusion, disorientation, and even seizures. Jaundice is the yellowing of the skin and eyes due to a buildup of bilirubin in the blood. A liver damage can also impair the production of clotting factors, leading to increased bleeding, bruising, and a higher risk of internal bleeding. It's important to be aware of these complications and monitor them closely in patients with liver disease. Maintaining a healthy weight, staying active, and eating a balanced diet are key lifestyle changes that can help prevent liver diseases. Vaccines for hepatitis A and B are highly effective in preventing infection and protecting the liver from damage. It's important to avoid excessive alcohol, practice safe sex to prevent hepatitis C, and take medications only as prescribed to protect the liver. Regular checkups and early screening can help identify liver problems early before they become serious issues. The healthy, glowing liver in the image represents the benefits of these prevention strategies. A balanced, nutritious diet is essential for liver health. Focus on fruits, vegetables, and whole grains and limit processed foods, saturated fats, and added sugars. Regular physical activity promotes healthy blood flow to the liver and can help prevent fatty liver disease. Aim for at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week. Excessive alcohol consumption is a major cause of liver damage, so limiting alcohol intake or abstaining altogether is crucial for maintaining a healthy liver. Maintaining a healthy weight is important, as excess weight increases the risk of non-alcoholic fatty liver disease and other liver conditions. Consult a healthcare professional for personalized advice on weight management. Medications, both prescription and over-the-counter, can potentially cause drug-induced liver injury if not used properly. It's important for patients to discuss the risks of liver toxicity with their doctor before starting any new medication. Even common OTC drugs like pain relievers can affect liver health if taken incorrectly or for too long. Dietary supplements, including herbal remedies and vitamins, may also have adverse effects on the liver that patients should be aware of. Knowing the potential liver risks associated with different medications is crucial for maintaining good health. The liver is a vital organ that can be impacted by herbal supplements, both positively and negatively. Many herbal supplements are not regulated by the FDA, so their safety and effects are not well understood. Some can potentially cause liver damage, especially when combined with medications. Certain herbs can increase liver enzyme levels, which may indicate liver injury. However, not all changes in liver enzymes are necessarily harmful. Herbs can interact with medications, potentially increasing liver toxicity. It's crucial to always consult a doctor before using any supplements. Some herbs claim to promote liver detoxification, but more research is needed to understand their efficacy and safety. When using herbal supplements, it's important to be aware of the potential risks and to closely monitor any changes in liver function. Liver disease is a serious issue that can affect children, often due to congenital conditions, genetic disorders, or infections. Common causes include hepatitis A, B, and C, as well as autoimmune disorders. Symptoms to watch for include jaundice, fatigue, abdominal pain, swelling, and changes in urine color. Infections can also cause fever, nausea, and loss of appetite. It's important to be aware of these symptoms and seek medical attention if they arise. The liver is an essential organ that plays a crucial role in our health, and as we age, it's important to understand how liver function changes. Aging naturally affects the liver, making older adults more vulnerable to liver disease. The liver's blood flow and enzyme activity decrease with age, which can hinder its ability to detoxify and regenerate. Older adults often take multiple medications, which increases the risk of drug-induced liver injury. This is an important consideration, as liver problems can be difficult to diagnose in the elderly due to pre-existing conditions. Early detection and proper management of liver disease in the elderly are crucial to prevent complications and ensure the best possible health outcomes. Liver disease can cause significant physical and emotional distress for patients. Palliative care aims to alleviate these burdens and improve quality of life. A key focus of palliative care is managing debilitating symptoms like pain, nausea, and fatigue. The care team works to keep the patient as comfortable as possible. Psychological support is also critical. Patients and families receive counseling and guidance to cope with the challenges of end-stage liver disease. Advanced care planning discussions help ensure the patient's wishes for treatment and comfort measures are known and honored, especially as the disease progresses. When a cure is no longer possible, hospice care provides specialized support and services to the patient and family in the final stages of life. Liver disease is a major health issue, affecting millions worldwide. Fortunately, there have been exciting advances in research to address this challenge. I'll briefly cover 4 key areas of progress: gene therapy, cell therapy, immunotherapy, and drug development. Gene therapy holds promise for treating genetic liver diseases by delivering corrective genes. Researchers are working on effective ways to get these genes into the liver cells that need them. Cell therapy involves transplanting healthy liver cells to repair damaged tissue. Scientists are developing techniques to grow and deliver these cells more effectively. Immunotherapy aims to combat liver diseases by modulating the immune system. The goal is to reduce inflammation and damage by targeting the underlying immune response. New drugs are also being developed to target specific pathways involved in liver disease. These medications have the potential to improve liver function and slow disease progression. Early detection of liver disease is crucial as it allows for timely intervention, preventing the condition from progressing to more serious stages. With early treatment, the chances of successful disease management and better long-term health outcomes are significantly increased. Prompt diagnosis and treatment can help prevent or minimize the development of complications associated with liver disease, such as cirrhosis or liver failure. Addressing liver disease in its early stages can greatly improve the patient's quality of life by alleviating symptoms and maintaining liver function. The combination of early detection and appropriate treatment is key to achieving the best possible health outcomes for individuals with liver disease. A patient's need accurate, easy-to-understand information about their liver condition to feel empowered and take an active role in their care. Support groups can provide a sense of community and shared experiences, which is invaluable for patients dealing with a liver disease diagnosis. The emotional and psychological impact of a liver disease diagnosis is significant, so addressing mental health needs is crucial. Adopting healthy lifestyle habits, like diet and exercise, can greatly improve liver health, so patients require guidance and support to make these changes. Liver disease is a complex condition that requires a comprehensive approach to management. We've developed tailored care plans to address the unique needs of each patient, including medical treatment, lifestyle changes, and supportive care. A multidisciplinary team of hepatologists, gastroenterologists, nurses, and other specialists collaborate to provide coordinated, high-quality care. Registered dietitians work closely with patients to guide them on dietary modifications, including appropriate calorie intake, fluid restrictions, and essential nutrient intake. Patients receive comprehensive education and support to help them understand their condition, explore treatment options, and effectively manage their disease. The liver is an incredibly important organ that performs many essential functions for our overall health and well-being. It plays a crucial role in detoxifying our bodies, metabolizing nutrients, and producing important proteins. That's why maintaining a healthy liver is so critical. It underpins so many aspects of our physical health. Early detection and proper treatment of any liver issues is essential. Catching problems early gives us the best chance of managing them effectively. And we can all take proactive steps to support our liver health, things like exercising regularly, eating a balanced diet, and moderating our alcohol intake. By taking care of our livers, we're investing in our overall wellness and setting ourselves up for better long-term health. Diseases of the liver can have a significant impact on our health and well-being. From viral infections like hepatitis to fatty liver disease and liver cancer, it is important to be aware of the potential risks and symptoms associated with these conditions. If you suspect that you may be experiencing any liver-related symptoms, it is important to consult with a healthcare professional for a proper diagnosis and treatment plan. Remember, early detection and intervention can greatly improve the outcomes for liver diseases. Thank you for watching, and stay healthy.